Hello, and thank you for your interest in the Masters of Science in Human Nutrition and Dietetics at University College Cork. In this short video, I will talk you through the application procedure for this degree, the entry requirements, the main structure of the course, and talk about CORU approval. There will be a separate short recording which covers frequently asked questions that we get from candidates who are interested. My name is Aoife Ryan and I am acting as Programme Director on this Masters for the coming academic year. First of all, the course practicalities. This programme is a full-time programme which is run over 3 semesters per year and over 2 calendar years. So students begin in September of their first year, and it takes a full 2 years before they will be able to work be right on the CORU register and ready to work as a dietitian. This is an NFQ Level 9 award, so a Bachelor of Science and Honours Bachelor's degree is a Level 8, so this is a Level 9, and a Level 10 would be PhD, so it equates to an NFQ Level 9. The academic curriculum is complemented with a clinical skills curriculum which is delivered simultaneously. So students on this programme attend lectures daily, and there is obviously time in their timetable dedicated to independent learning during semesters 1 and 2 of first year. In semester 3 of first year, students begin their clinical training, and in total over first and second year they are required to complete 28 weeks of clinical placements between year 1 and year 2. For the entry requirements, applicants must hold a minimum of a 2-1 honours primary degree, which is a Bachelor of Science degree, and I'm afraid we cannot make any exceptions for this. You have to have an undergraduate Bachelor of Science degree or a postgraduate Master of Science degree, and in your transcripts you have to show evidence that you have completed a minimum of 10 credits of human physiology and 10 credits of biochemistry. If you do not meet these, I'm afraid you have to look at alternative methods of meeting these requirements, and I will discuss how you can do that in the second recording under the frequently asked questions section. So suitable background degrees that we would welcome applications from would include students with a bachelor or master's degree in nutrition, biochemistry, physiology, biology, food science, medicine, nursing, physiotherapy, speech and language and occupational therapy, as long as those students provide evidence on transcripts that they meet the biochemistry and physiology requirements. When you log online to apply, you will be required to upload the following documents. First of all, a brief personal statement of up to 500 words is required, which highlights your reasons for applying to the programme and stating your suitability to this programme. We also ask that 2 letters of recommendation are uploaded with your application, one of which needs to be an academic reference from a previous lecturer or research supervisor that would know you well and is able to attest to your academic abilities and character. If you are currently in your final year of your Bachelor of Science degree and do not have your final year results, we would ask that this academic reference that you would ask this person providing the academic reference to provide an estimate of the degree band that they think you will land on in your final exams. The other reference should be a professional reference from perhaps a job or a work placement where the person writing it can attest to your character and professionalism. We also ask that you upload a short CV highlighting your main achievements to date, and again it's a chance to showcase any additional things you have done which may enhance your application. Students from outside of UCC, so who have obtained their bachelor or master's degree from another university, are required to upload their transcripts with their application. Former UCC students or UCC graduates, whether they're current students or graduates, are not required to upload these, as these are already available to us. You can apply for this course at www.ucc.ie/apply, and on this site you will be asked to create a profile and upload the relevant documents. There is further information available on our website on the link given here in the second bullet point, or you can just Google Dietetics at UCC, where you will see the relevant application opening dates and deadlines. All students that are accepted onto this programme will need to provide evidence of appropriate vaccinations, which would allow them to work in a hospital environment. And also just to say that students accepted onto this programme will also be required to undergo Garda vetting. So how do we shortlist students for interview? Well, every application will be reviewed in detail and scored based on the following. So their educational qualifications, their CV, the 2 letters of reference, relevant work experience, and their personal statement. We will be likely to interview the top 30 students who apply and make offers to 12 and put the remainder on a wait list should anyone change their mind in the top ranked 12 students. So our intake per year at the moment is limited to 12 students. This is because of the significant element of clinical practice placement training, and of course the numbers of these placements are limited. We hope to increase to 14 students in the class in September 2022, as we will be opening up 2 places to international students. The fees for this course at the moment, I would encourage you to go to the fees section of the UCC website to look for up-to-date fees. For the 2020-2021 academic year, the fees are €12,000 per year. You can speak to the fees office about this. Is not paid in the one go, it's paid in installments, and you can talk to the fees office about arrangements for that. At the moment, we do not offer any entrance scholarships. This is something we may look at in the future, but not right now. The fees are covering, the course is basically covering costs in terms of the teaching costs and the overhead costs of running a course like this at university. So this is not a profit-making course at all, but at the same time, UCC is very dedicated to the delivery of this programme, and it is going to be a permanent fixture in our offerings of master's degrees going forward. Who teaches on this course? So the course is comprised of 3 registered dietitians who do the bulk of the teaching and coordinating of modules in first year. So I am the programme director, Aoife Ryan. I have been a lecturer at UCC for 10 years now and worked as a clinical dietitian for 7 years prior to that. We have recently been joined by Dr. Majella O'Keefe, who is also a registered dietitian and who comes to us from King's College in London, has significant experience teaching on dietetics master's courses. And the 3rd permanent lecturer on this course is Dr. Samantha Cushion, who has been working at UCC now for over 3 years and was a key person involved in the design and development of this course. The academic team is complemented by 2 practice tutors. Both of these are part-time dietitians. They work 3 days a week each, and they work the other half in the HSC setting. And these practice tutors are very, very important because they help coordinate clinical practice placements, and they visit the students when they're out on their practice placements, whether it's in the hospital or the community. We also have a vast array of guest lecturers, so specialist dietitians from hospitals, the community, medical doctors, behavioural change experts, dietitians working in industry, private practice, and of course a whole catalogue of experts within the College of Medicine and Health, and within, of course, our own School of Food Nutritional Sciences. And of course, this all allows for the opportunity of interprofessional teaching as well. There are a variety of resources and facilities available for dietetic students at UCC, including clinical teaching spaces, which are housed in the School of Medicine and the School of Nursing. The College of Medicine, I should say, in the School of Nursing. There's a clinical research facility based in the Mercy University Hospital. Of course, the UCC library and campus itself, and a kitchen space for food prep skills, and also nutrition laboratory spaces. So just briefly to look at the curriculum, in Year 1, Semester 1, students take 30 credits. The core modules consist of 25 credits of these 4 modules here. So fundamentals of diet therapy and assessment is essentially a module going through how to do a comprehensive nutritional assessment in the clinical one-to-one setting. Students also receive 5 credits on dietetics through the life cycle. Sorry for the typo. They also receive a 10 credit module on professional practice and interpersonal skills, and they receive 5 credits on a medicine module, which is taught predominantly by medical doctors to give students the necessary medical background knowledge for them to work in a clinical setting. Students then take one elective module in semester 1 of year 1, and these will depend on the student's background. So students who have a pre-existing nutrition degree are encouraged to take this health promotion module, which is offered from the School of Public Health, or students who do not have a nutrition degree as their undergraduate degree are encouraged to take this module here called Integration and Regulation of Nutrient Metabolism, which is a 5-credit module on nutritional biochemistry. Year 1 semester 2 also comprises of 30 credits. Here students take, so this happens after Christmas of year 1, 10 credits of this module called Advanced Medical Nutrition Therapy, which is the main dietetics module and goes through the dietary management of a variety of diseases. Students also take a food skills and food service management module worth 5 credits. They do 5 credits of applied research for dietetics and 5 credits of public health nutrition. And at that stage of the course, which takes you to about May of year 1, students are completely finished with the academic components of this master's degree in terms of taught content. Semester 3 then of year 1 is where students begin their first clinical practice placement, which is worth 5 credits, and it takes place for 7 weeks. Students then have approximately 6-7 weeks of summer holidays before they come back to begin year 2. Year 2 is also 60 credits, so in total we have 60 credits in year 1 and 60 credits in year 2, which gives us 120 credits for this MSc. So year 2 60 credits consists of a clinical placement to the value of 20 credits and a dissertation on a research project to the value of 40 credits. So semester 1 is clinical, begins in September of year 2, and students are all out on their second practice placement, which is worth 5 credits and runs from September to December of year 2. After the Christmas holidays, students come back and the class is split into 2. Half of the class go on to complete their third clinical practice placement, which is a 15-credit module and is the major or core clinical practice placement session, which has to comprise of at least 400 hours in an acute setting to meet CORU requirements. The other half of the class are working on their research dissertation, which is a 40-credit dissertation. So this spans the entire academic year from September to when it's due in July. So students have the full year to work on this dissertation, but they do have a period of about 11 weeks in semester 2 when they're not on placement, where they will be working full-time on this dissertation. Assessment throughout this master's is comprised really of continuous assessments and formal exams. So it consists of, performance at tutorials, presentations, class tests, essay style, continuous assessment projects, OSCEs, which are objective structured clinical examinations, and of course work placement assessments. This is an example of what the timetable looks like for semester 1 of first year, and you can see that students are really expected to be engaged with their modules and learning full-time from 9 to 5 each day. There are free periods on Thursday and Fridays, which is for independent learning, and we have been kind of running some live tutorials during these sessions as well the last number of weeks. Just a short word on practice placements. So CORU requires that all students complete a minimum of 1,000 hours of clinical practice training, and 400 hours of which have to be in the final year of the programme in one block in an acute setting. The way we have structured this Masters at UCC is that students will actually complete about 1,036 hours. This is just to give a cushion in case students are absent due to illness or other reasons. And it works out at about 28 weeks of placement in total. So practice placement 1 is 7 weeks, practice placement 2 is 9 weeks, and practice placement 3 is 12 weeks. There are a number of supports in place to help students during their practice placements. As I mentioned previously, we have 2 practice placement tutors who are responsible for coordinating and organising practice placements. They also provide on-site support for students and one-to-one supervision and feedback. They're also responsible for collating the assessments and running weekly tutorials on a Friday in UCC while students are on placement. All of our practice placements will take place in the South-Southwest Hospital Group, which is our local regional hospital group and comprises 9 different clinical settings. It is envisaged, though, that the bulk of the clinical training will take place in the hospitals in Cork City. So Cork University Hospital, the Mercy University Hospital, the South Infirmary, and also in University Hospital Kerry would be where the bulk of the practice placements would happen. UCC has negotiated a memorandum of agreement with the South West Hospital Group, which is a kind of a legal framework, which means that the clinical nutrition, the clinical dietetic managers in these hospitals have signed up basically to taking UCC students, and through investment from both UCC and the HSE, this has meant that we've been able to increase capacity for training in this region, which did not exist before. And this is just photographs of practice placement sites where our students will be placed. So this is obviously an integral component of professional education, and it is a requirement that the placements that we offer students reflect the breadth and diversity and working conditions of dietitians. So it must include acute care, primary care, public health, health promotion, and food service. So obviously I've already explained to you that, we have a team of practice placement tutors, and all of the staff involved in training students must be CORU registered dietitians. Just a final word on CORU before I finish this presentation. CORU is Ireland's multi-professional health regulator, and their remit is to protect the public by promoting high standards of professional conduct, education, training and competence through statutory registration of health and social care professionals. So to work as a dietitian in Ireland, you have to have CORU registration, as this title is legally protected. So dietitians are the only nutritional professionals who are regulated and governed by an ethical code to ensure that they always work to the highest standards. And as such, then, education programs delivered at third level to train these professionals are subject to a stringent approval process. So CORU is our regulator. CORU does not approve courses until the first cohort of students has begun. So this is a 2-year process which a university engages in, and it begins once you take in the first intake of students. So we are often asked, is our course CORU approved? The answer is no, it is not approved yet, but we are in the process of trying to get it CORU approved. And we've already had a number of meetings with CORU, and on this panel here you'll see the timeline. So the process started in September 2020. We have until May 2021 to submit our documentation to CORU. There will be a series of visits that CORU will make to UCC over the course of the next 2 years, and we would expect an approval in principle to happen around November of 2021. Between November and February, I should say, February 2022, which would then, excuse me, allow changes to the bylaw, which means that graduates of this course can automatically go onto the CORU register. I should say also that all courses that are CORU accredited are required to undergo monitoring every 1 to 5 years. So this is a continuous process where we will be engaging with CORU to get accreditation and maintain accreditation as we go forward. So finally, in summary, Dietetics at UCC, the core focus of this program is to train dietetic students and create the future dietitians of our profession, and with the appropriate professional skills. We have to deliver practice placements which are evidence-based and an ethical approach to practice. We have to provide integrated and relevant medicine, therapeutics, communications and behavioural psychology education to our students. And also we have to ensure that they become independent researchers, as evidenced by a dissertation in clinical nutrition and dietetics, which would be relevant to the needs of students and their career aspirations. In terms of career opportunities, this master's program will offer a professional qualification in dietetics practice, which will enable graduates to work in any of the following areas. So in the clinical nutrition and dietetics field, whether it's in hospital dietetics or community dietetics, graduates can also go on to work in the food industry or the clinical nutrition industry. Some will go on to work in public health nutrition for various different government health and promotion agencies. Some work in the pharmaceutical industry, some work in sports nutrition, some open private practices. Others go on to complete further study, as in PhD level study, to get involved in education. Many will go on to do future research degrees, and of course this qualification also allows our graduates to travel and work overseas in other English-speaking countries where they can sit the RD exam. So thank you very much for listening to this presentation. There is a separate presentation uploaded now which will cover frequently asked questions that students regularly get in touch with us about. So thank you for listening, and thank you again for your interest in this programme.